On this week's Cardiology Countdown, we'll begin with an overview of how to manage antithrombotic therapy peri-procedural interventions. And so putting in ICDs and pacemakers in patients who are taking aspirin, dual antiplatelet therapy, warfarin, anticoagulation, how should that be managed? In theory, one would want to get off therapy, hold that for the period of intervention, and then resume it, but there really aren't good data or strategies for that. And so an overview looked at 13 different studies that reported bleeding complication rates with the various therapies compared with those patients who were on no antithrombotic therapy. And not surprisingly, any of the various antithrombotic therapies increased the risk of bleeding. But the one real standout were patients who had been on warfarin, who had a heparin bridging strategy peri-intervention. And this had an 8-fold higher risk of bleeding. Now, some of this may be observational, but really did stand out as compared with simply continuing warfarin alone. That did not appear to increase the risk of bleeding significantly. And so this has suggested that continuing warfarin anticoagulation may be a suitable approach to device implantation. At the number 2 spot is a study called FISH. The fish oil in stenosis for hemodialysis grafts, a little bit tortured acronym, but one that aptly looked at fish oil in a randomized study of patency of hemodialysis grafts. This was a small study, just 200 patients, and they looked at graft failure requiring intervention, didn't see a significant reduction in the primary endpoint as defined, but did see about half the risk of thrombosis or intervention individually, and a lower rate of cardiovascular events, even in that modest number of patients. And so a small study, but one that is a growing drumbeat of studies showing the benefits of fish oil. And at this week's number 1 spot is a sobering trial of children with diabetes, age 10 to 17, with type 2 diabetes. That is the diobesity epidemic that we all fear. A study that looked at the use of metformin, lifestyle intervention, or rosiglitazone, the PPAR agonist, and looked at glycemic control after a 6-month period. They found that metformin was associated with sustained glycemic control, but that the lifestyle intervention alone really didn't do the trick. And on the other hand, adding rosiglitazone, not surprisingly, had improved glycemic control. Now, out of all of this, I think the most sobering thing is that youth can develop type 2 diabetes requiring 1 and 2 drug therapies, and in whom lifestyle intervention really does not appear to be that successful, at least as practiced currently. And so a call to action for all of us to try and focus on obesity and the root causes of type 2 diabetes in youth, and then the need to examine what are the best therapies going forward for the then long term. For this week's Cardiology Countdown, I'm Chris Cannon.